sometimes I feel like that's better. This is probably stuff you've already kind of gone over, but we'll go over it now. So Prelude is an awesome company, and I will talk a little bit more about them specifically and also about our Houston practice. So of course, we embrace everyone, and we really do want to help you start your family. It's definitely a passion of mine as a gay woman. I really feel it's important that we have access, that everyone has the ability to start a family if they want to. And so it's something that I'm really passionate in trying to get more folks in Houston aware of us. So, you know, an egg donor, you can choose the anonymous or the known donor. So we do have the in-house donors. We work with my egg bank. If you choose someone, we can also help with that screening process and all the medical testing that would be necessary for them. The carrier, again, anonymous or known. A lot of the same medical screening applies to that in terms of, you know, legal contracts. That's something that if you don't go through an agency, then we would try to help you arrange all of that as well, because that can be a little bit overwhelming and daunting. And then in vitro fertilization, so as you know, as you've provided the medical background, it involves stimulation of the donor's ovaries so that we are able to grow multiple eggs at the same time, and once they've reached the point of maturity, then we would retrieve those eggs. They are taken to our embryologist right there and then fertilized with one or both of your sperm and then grown in the lab for 3 to 5 days. And so at that point, you know, they can be transferred to the carrier. So, you know, we do really care about your story, and we want to customize things as much as we can for you. Even though we're a big practice, it's really important to me and us as providers in general that we take your history into account, your desires into account, and try to make this the smoothest journey that we can for you. And as I was saying, I think I said this to the last group, but, you know, in talking with our donor coordinators, I said, you know, is there something that you want me to pass on or something that you think is important for folks who are at the conference to know? And they did say, you know, if you have someone who's going to be either an egg donor for you or a carrier, that you know them really well, that it's not just a neighbor or someone who you don't really know, because you may get into the details of the contract, you may have spent a bunch of money and then realize that maybe this person isn't the best fit for your pregnancy and for starting the family. So that's something that's important. If you're not using an agency, just make sure that you've spent a little time with this person. And so Texas is a very surrogate-friendly state, and so that is something that, you know, they allow married couples both to be on the birth certificate, which I think is something that, you know, a lot of states don't. So that is good here. So again, connecting with the team. So, you know, we do have an office in the Woodlands. We can always do phone conferences. We can do Skype. You know, unfortunately, I don't see patients in the Woodlands, but we do have providers that do. I see, you know, patients in the Med Center, Pearland, Katy, but I'm happy to try to be as convenient for you as I can be. If you want to do Skype or, you know, any phone consults, I'm always happy to do that. If you want to, you know, folks have a known donor or carrier, we can always Skype with them too. And then we have financial coordinators who help coordinate that as well, third-party donor. Like, everybody tries to coordinate this. We do this a lot, so it has become a fairly streamlined process for us. So you know about the psychological evaluation counseling. So the egg donor is psychologically screened, the carrier is psychologically screened, the carrier's partner is often brought into the picture as well. They're psychologically screened, and then typically the 4 of you would actually all meet together to just make sure that the dynamics are, and motivations and everything is going to be something that's going to be successful. And so yes, we do also screen you medically, and then, you know, kind of review everything, go over the timeline. You know, a lot of this stuff. We do offer services for HIV positive men as well. And the pregnancy test occurs 2 weeks after the transfer. We follow the carrier through 12 weeks of gestation and then help guide them to an OBE. Okay, that's the biggest thing here. We have 27 locations. Prelude has 27 locations across the country, and then 14 in Houston. And so I've talked a lot about our practice as well. So, you know, if you have any questions about Prelude or Houston Fertility Institute, please let me know. Otherwise, we. So Prelude is, they have our lab. They oversee all of the in vitro fertilization labs. So part of the reason, you know, it's so successful is that it's a very standardized practice, and then plus the 2,700 cycles or so that we do a year. So that makes that an advantage. But Houston Fertility Institute includes all of the clinical side of things, and I guess the surgery center is also Prelude. So yeah.
Yes, Prelude is just our network, and Houston Fertility Institute is part of that network. But yeah, like Dr. Hoff said, the lab and the surgery center are kind of a Prelude venture, but it's all in coordination with HFI, and everything is seamless on the
yeah.
They're just part of a bigger network of practices. But from y'all's perspective, from a patient's perspective, it's pretty seamless. There's not, a Prelude.
Right. That's a good point. Yeah. So I think across the country, a lot of the labs are owned by a few of the larger companies that have networks, and that has improved success, I think, and just, yeah.
What's your rate of single embryo transfer?
Single embryo transfer, I think we're about 80%. But that would be in women less than 35 or women less than 37. So the new ASRM guidelines came out in 2017, basically saying any normal embryo, we want to do a transfer of one embryo if at all possible, especially if it's been genetically tested. And so that has really guided us to do single embryo transfers. We do have a deviation form, which occasionally we will allow patients to sign after extensive counseling, but that's something that is important to remember, that twin pregnancies have a lot higher rates of complications. They're often delivered earlier. They spend time in the NICU. So it's something that you do have to consider, especially if you're using a carrier, that is something that may happen and may also contribute to more financial aspects to the process as well.
So is that something you would advise against, doing like a double compared to a single?
I do tend to, just because the pregnancy rates are so high. Singleton pregnancy is a lot healthier for that woman who's the carrier, but also for the child. If you have two children that are born at 26 weeks instead of 38 weeks, it is a disaster, and they may not be neurologically intact. And of course that's some more of the worst case scenarios, but they happen. And so things like that, really shape our view on it when you're putting all of this effort into it, you're putting all of this money, and you have so much invested in this, and the stakes are so high that when we know we can give you a single live healthy birth, that's where we like to go. And of course I understand, having two children under this would be ideal, and there are a lot of twin pregnancies that go on completely normal and fine, but it's the ones that don't that really stick with us, that have us really guide you towards one.
So all of your resources, are they Texas-based, like all the egg donors and surrogacy?
Yes. Yeah, so the surrogacy, we can work with any agency really, but obviously it's ideal if they are in Texas. So a lot of the agencies that we work with, their surrogates are either in Houston or for sure in Texas. But really, like, again, this is one of those benefits to being able to choose your surrogacy agency, is if there's someone or if there's another surrogate that you would choose that would be farther away, that's definitely an option for you. But we do try to keep it local just for logistical purposes to make it easier for you. And we, our egg donors, again, like I said, we have this donor bank that we use. We have active donors, we have frozen donors. But should you not find anyone that you find acceptable there, of course, we're going to work with one of the bigger banks or my egg bank. So, it's all Texas-based if you want it to be, but we can also branch out.
Are there any pros and cons for those wanting to be the intended parent?
No.
As far as embryos?
Absolutely not. Totally acceptable. We encourage it a lot of times. So it's up to you how you want to do that. If you want to keep them separate, if you want to just have them together and not know, totally fine.
What we did is we had 18 eggs from the donor, fertilized half with the sperm, half with me. It was in the freezer for 3 years. We transferred fresh first, which didn't work, so they were all frozen. But then we tell our kids that they were twiblings. They were conceived the same day. One was frozen for 3 years, the one 3 years apart. So we still have a few twiblings that are never seen a day.
And that happens too, right? Yeah, that's excellent.
Actually, in the same line of question, a question in common. Do you have a program for sibling journeys? Maybe better deal in doing it two singletons, like two singleton journeys in tandem.
Right.
Or
So
these guys, for instance, say we want 2 kids.
absolutely. That's a great question. Great question. So that brings up a good point. Even though we wouldn't like to transfer 2 embryos, we will have additional embryos that are frozen. And so a frozen embryo transfer doesn't involve any of the stimulation again. You don't go through the IVF process, the retrieval, the fertilization, all of that. Everything's already done there. So you have the cost of a frozen embryo transfer, which is much, much, much less than this initial stimulation. So yes, great question. That is very helpful. So then you would have, siblings available for transfer. And, if you wanted to use the same carrier or different carrier, something that would be totally up to you. Good questions. Love it.
Do you guys have like a rough estimate? I know the previous presenter did, as far as what just on average what it'll cost going with you guys.
I don't really, our financial accounts, I can get you that. I can email you that. Part of the reason, I guess I should have a better ballpark, but part of it is that they do keep us a little bit further removed from some of the financial aspect and allow our financial counselors to work with all the insurance companies and figure out the details so that we focus only on the medical part, which can be an advantage and a disadvantage. So, it's something I always try to be mindful of. I grew up on a farm in South Dakota, so I, did not grow up with wealth, and so I always like to say that, it's really important for me never to forget, like, this is such a big investment and so important that, every little bit can matter. And so, we do take that into account and always try to find ways that we can cut costs where we can.